Hi, everybody. Good morning. I think we're going to go ahead and get started. Thank you all so much for being here with us this morning. I apologize for my voice. My friend and colleague, Tom O'Callahan, sitting right here in the front, has graciously agreed to take my spot if my voice starts really failing. But if you don't understand what I'm saying, just wave your arms, and we can substitute in a new speaker for me. Thank you all for being here. I have the pleasure of introducing a really distinguished panel here. Before I do that, and before I ask them to make their opening remarks, just like to say who I am. My name is Sandhya Rao. I work at the U.S. Agency for International Development here in Washington, D.C. I work on public-private partnerships, and over the last few years have had the pleasure of engaging in some global partnerships that focus on mobile technology and health. The first one being a partnership that we launched a few years ago called MAMA, the Mobile Alliance for Maternal Action, with Johnson & Johnson, the mHealth Alliance, the United Nations Foundation, and Baby Center. And following on a lot of the lessons that we've learned over the years in mobile technology and health, we started to ask ourselves, what can we do for frontline health workers? They are... see if I can get this right. They are often the first and only link to healthcare for millions of people living in the developing world. They are, in our opinion, the most effective and immediate way to save lives and improve health. And those of you who are working in healthcare would probably agree that equipping and training and supervising frontline health workers is really the most effective way to achieve the Millennium Development Goals. These are some of the challenges that are faced by frontline health workers on a daily basis. Again, those of you working in the field know this really well. Inadequate training, lack of skills and capacity, insufficient equipment and supplies, lack of clinical decision support processes, inability to make timely diagnosis, treatment, referral, and follow-up, etc. The rest are on the slide here. We think over the last several years, USAID and others have seeded these amazing innovations in mobile technology and health, particularly to support frontline health workers. And so, we've seen some of these innovations, which many of you have probably been hearing about over the last 2 days. This is a very detailed slide. I'm not expecting you to read it all, but let me just point out a few things on the slide. The first is, we've got some pretty stark challenges in global health. Lack of awareness and knowledge among patients about when to seek care, low pregnancy registration, low exclusive breastfeeding rates, poor treatment of diarrhea. We also have issues around health worker performance incentives. So health worker visits are often short or unstructured. Sensitive topics such as family planning or HIV may be missed or skipped. The lack of referrals or maybe even delayed referrals, as well as health worker monitoring and supervision. So how can mobile technology tools actually help us overcome these challenges? Well, over the last few days, and I'm sure in the work that all of you are doing, you've seen a lot of solutions, and many of them have been really tremendously successful, most of them at a relatively small scale or pilot scale. So we've seen SMS and IVR information services. We've seen protocols, phone-based protocols for clinical decision support. We've seen job aids. We've seen video and audio information to support health worker interaction with patients. We've seen real-time monitoring and supervision of daily activities through mobile phones. We've seen a lot of great examples. And the question that we asked ourselves at USAID as a donor in this space is what can we do to really help to improve the performance of health workers in this sort of paradigm of this equation, which is essentially increased uptake of high-impact health behaviors, plus improved performance of health workers, as well as an improved health system and quality health services, how does that ultimately improve maternal and child health, maternal, neonatal, and child health? And so we really wanted to answer the question at scale for how we can harness mobile technology to improve health worker performance in particular. We also knew that we couldn't do it alone. So if we're really looking at scale, we're looking at the need for more partners and a diverse set of partners. We knew that we needed resource partners to bring cash and in-kind donations of technology, of multimedia digital health content, of technical assistance. We knew we needed advocacy partners to get the word out about what the possibilities were and what the potential would be for mobile technology. We also knew that we obviously needed implementing partners who would actually create and adapt technology solutions and health content. And of course, technical advisors to keep us grounded in the practical realities. Sometimes we have these global partnerships and we think we know what we can achieve, but it's not really grounded in the realities of different countries. So how can we actually assemble a really stellar group of technical advisors to help guide us in this partnership? And finally, we needed research partners to conduct formative operations and evaluation research, not only to improve solutions and document best practices, but also to encourage global learning. So really encourage this cross-cutting collaboration across technologies, across partners, across countries. So basically, thinking through who we needed in each of these partner categories, we assembled a really amazing group of partners, 10 partners in fact, plus the mHealth Alliance, who is serving as the partnership secretariat. And you see on this panel a few of our partners, which I'll have a chance to introduce in a second. We launched the partnership at the Child Survival Call to Action in June. This is a picture of 7 of the partners who could make it to that event. And Patty Michelle, the Executive Director of the mHealth Alliance, who actually launched the partnership for us with a spotlight. The founding partners, the partnership goal: to end preventable maternal and child deaths by accelerating the use of mobile technology at scale. To me, those are the key words, is at scale. We've done a lot of seeding of different pilots around the world, but we know a lot about what works. So what can we do at scale with a diverse set of partners to strengthen the skills and performance of frontline health workers? Can you all still understand me? Okay, thanks. So the founding partners are all of these. I won't go ahead and name everybody, but you can see that it's quite a diverse set. Again, going back to the slide before, resource partners, technical partners, advocacy partners, and all of these partners actually serve on a steering committee. What we've learned over the past few years in terms of partnership governance is that you really do need a steering committee. You need somebody who wakes up every morning and, at the beginning of the day and goes to bed at night thinking about this partnership. And so we actually have a job description that we're recruiting for right now for the partnership director. If anybody's interested in finding out more about that position, please come see me after. We will have an actual staff. We'll have a partnership secretariat that's based at the mHealth Alliance. There'll be somebody who's managing content. We'll have a research person, et cetera, et cetera. So we'll have dedicated resources to this. Through this partnership, we're aiming to address some of the barriers to scale up that we've been hearing from the mHealth community. The lack of interoperability, shared standards and terminology, evidence generation for multiple types of stakeholders, so not just for the public health researchers or the donors, but also for the mobile operators in the private sector, reusable tools, technologies, and content, sustainable financing models. So it's not necessarily just about commercial business models, but how do we actually build in revenue streams from a variety of sources to sustain these initiatives and partnerships. Of course, private sector engagement. We already have engaged with several private sector partners, and you'll hear from some of them today. And then country ownership and leadership. I'm sorry that that's last because that should really be first. When we work with host country governments, we're really looking for local ownership, a local coalition to sort of take the lead. This is what we've done with a lot of our other partnerships. This is a little bit about the content of what we're trying to do. The focus is in three main areas: the crowdsourcing, creation, and storage of multimedia digital health content, SMS, audio, video, images. What we asked ourselves, we've been paying for the development of this digital health content in many countries around the world. Is there a way that we can actually share this content across countries, across content partners, across implementing partners? Is there some amount of this content that can actually be standardized and shared and then locally adapted and validated in different contexts? So that's a big part of what we're going to be doing. The other is scaling up actual content and applications in developing countries. So there's a whole task force. We have 4 task forces under this partnership. One is around content and the storage and crowdsourcing. The other is around country scale-up initiatives. The third is around communications and advocacy efforts. And then the fourth is research and evaluation and global learning. So under research, advocacy, and global learning, all of which are very much tied together, we're planning to really put in place a rigorous monitoring and evaluation plan and collect information for the variety of stakeholders that we think would be interested in investing in mHealth at scale for frontline health workers. So what's new about this? And we've been asked this question a few times, and we have actually just recently engaged Vital Wave Consulting to undertake kind of a strategic assessment of the first piece of this, which is around the content library and crowdsourcing platform, to really make sure that what we're doing is not duplicating what might be done in other places with other organizations. And so they're really setting the context for the work that we're doing and providing us with a set of approaches for how we actually build a content library or portal to enable the sharing of this content. So as a first step, I think this crowdsourced content library, we think, based on a lot of the people that we've spoken with in the mHealth and the global health community, we think that's a new added value of this partnership. The other is replicable and scalable mHealth solutions, particularly for training, motivating, supervising, and supporting frontline health workers. We know that there are platforms out there. We also know that they haven't been brought to scale. We would like to try to analyze the barriers for why that is and try to address those. Finally, and I've said it a few times, multiple partners, diverse set of partners to facilitate scale up beyond the pilot. And then finally, a global learning platform, particularly to accelerate peer-to-peer learning and exchange, not only amongst mHealth practitioners, but really amongst global health practitioners. I think oftentimes we are always talking to ourselves about mHealth, and I think the next stage is really to bring our learning to the broader global health community, to mainstream mHealth, at least the thinking around mHealth, and try to get a wider audience for some of the initiatives that we've seeded. So just my last slide, which is essentially a diagram of how we hope to impact at scale multimedia health content and standards, tested and validated through country applications. Scaling those up, we hope, will improve health worker performance and ultimately health impact. And across all of these pieces, we'll be collecting information to learn, to share, to evaluate, and to advocate for mHealth, for frontline health workers at scale. So I think with that, I'd like to just show you a very brief video that the Vodafone Foundation, a really wonderful partner of ours from South Africa, has created for this partnership. So if we could go to the video.
For millions of children across the world, frontline health workers are the first and often the only link to healthcare.
But these health workers face a multitude of challenges that prevent them from being able to care for their communities effectively.
So, how do we give them a hand?
By putting a powerful
Can you go back to the beginning?
Mobile technology presents us with an incredible opportunity to connect health work.
Sorry.
For millions of children across the world, frontline health workers are the first and often the only link to healthcare.
But these health workers face a multitude of challenges that prevent them from being able to care for their communities effectively.
So, how do we give them a hand?
By putting a powerful new tool in the palm of theirs.
Mobile technology presents us with an incredible opportunity to connect health workers to the communities they help.
And to the health systems that help them.
Mobile phones, netbooks, and tablets can speed up diagnosis, treatment, and referral.
They enable health workers to seek advice from a supervisor, call for emergency transport, and enter data that helps them keep track of their community's health.
Taking advantage of this opportunity is more than any one organization can handle, especially at scale.
That's why a group of partners have come together to scale up the use of mobile technology to support frontline health workers in Asia, Latin America, and Africa.
Together we can strengthen their capacity and improve their performance, helping them end preventable childhood deaths.
The partnership brings together some of the most influential and imaginative public and private sector organizations from around the world.
We have three main objectives: creating multilingual digital health content,
accelerating the scale-up of country programs,
and sharing evaluation results to enhance global learning on mHealth.
The work is just beginning. Join us, and together we can empower frontline health workers
and end preventable childhood deaths around the world.
Thank you. Great. So that's just a little overview of what the partnership is about. It's now my pleasure to introduce our panelists, all of whom are partners on this partnership. I think what I'll do is introduce everybody, if that's okay, and then we can toss out sort of a general question to all of you. Mike Gann is the Senior Director of Global Healthcare Enterprise Solution Sales at the Intel Corporation. Mike is currently the Senior Director for the Global Healthcare segment within Intel's Enterprise Solutions Sales Group. In this capacity, he is responsible for developing next-generation healthcare solution architectures, global business strategies, and public-private partnerships with the healthcare ecosystem to improve the quality, cost, and access to healthcare. Mr. Gann has conducted business in over 35 countries for Intel. I'm going to do kind of a shortened version, if that's okay, and hopefully you guys can fill in the blanks for me. Erica Kochi co-founded the UNICEF Tech Innovations Team, a group that is tasked with identifying and developing technology to improve UNICEF's work in the field. Working with partners in academia, development, and the private sector, the team's mandate includes connecting the wired and unwired worlds, streamlining distribution and reporting, and improving the efficiency and reach of messages. To increase the impact and scale of this work, the innovation team convenes partners in academia, private, and development sectors. Erica's team has been responsible for the development of Rapid SMS, which is a system that uses basic mobile phones and SMS messages to communicate with frontline health workers and improve the speed and quality of healthcare and data collection. Robert Jarin is Senior Director of Government Affairs for Qualcomm Incorporated. He's based in Washington, D.C. and represents Qualcomm on U.S. domestic regulatory matters related to wireless health and life sciences. His areas of responsibility include wireless health policy, FDA regulatory oversight of converged medical devices, healthcare legislative affairs, CMS telehealth reimbursement, and the regulation of health information technology. Robert also serves as the co-chair of the U.S. Policy Working Group for the Continua Health Alliance, and he leads the American Telemedicine Association A-Team, I'd like to know what that is, on telehealth and meaningful use. He's also the U.S. chair for the European American Business Council eHealth Policy Group. And Lee Wells joined the Vodafone Foundation to lead their health programs in Africa at the end of 2011. He has designed and is currently managing the Foundation's multi-million-dollar and multi-partner maternal health program in Tanzania as part of Vodafone Foundation's Mobile for Good commitment. Previously, he was the executive director of the Touch Foundation, delivering practical health system strengthening and human resources for health solutions in Tanzania, based out of McKinsey & Company's offices in New York. So thank you all for being here. Really appreciate your time, and would like to just open it up with a general question, which is, what interests you about this partnership? Why did your organization commit to joining USAID and the mHealth Alliance on this partnership on empowering frontline health workers? How does it complement your organization's overall strategy, programs, and or product lines? So just a few opening remarks.
Thanks, Cynthia. Again, my name is Mike Gann, and I'm the Global Director for Solutions at Intel. Just a brief history, I think, just to give you some context, because when you think of Intel, you don't normally think of healthcare. And our company's actually been involved in healthcare since 1999, going back to the days where we actually went into homes to study how people lived and worked to see if there's an opportunity to bring technology. So from the days of having ethnographers and social scientists to where we're at today, where we work with the ecosystem. These are the companies that have solutions in the hospitals and the clinics and for mobile health workers, really to help make sure that those things run well, those solutions run really well on Intel architecture so that it's performing well, patient data is protected. In terms of where we're going as a company, our CEO, Paul Lodolini, who's going to retire this coming May, basically said from a vision perspective and a challenge that we want to go out and be a computing solutions company to enhance the lives of everybody on the planet. And at a high level, that sounds nice and all, but if you really take a look at the words and what we're trying to do here, we are trying to have an impact. We are trying to make a difference. And when the opportunity presented itself with USAID and the mHealth Alliance to participate, we thought long and hard about this. Intel just doesn't jump into coalitions and alliances just for the sake of doing that. We think it's very important to take a step back and look at it. Intel and USAID actually have a very long-standing, good working relationship, so that was a key for us in terms of, we know how to work together, we know the common language and how to communicate and have success. And then secondly, the priorities of really trying to do something for infant mortality and maternal health was a big priority for us. So about 15 months ago at the UN, we actually announced a program called the 1 Million by 2015 program, where Intel basically stepped up and said, we're going to go help countries train 1 million workers by 2015. And that's, again, it's not something that we would put out there. We thought long and hard about it. So as we kind of thought about how we go to implement and execute that particular goal and commitment to the UN, we saw this as a great opportunity to partner with USAID and many of the folks on the panel here to see how we can pull the resources together, because it becomes very apparent that we can't do it. Intel is a great company, we have great technology, but there's no one entity out there that can do it on their own. It really requires those public-private partnerships and bringing the best practices and best-of-breed strengths and talents, and even the failures, learning from the failures. So from our perspective, it just seemed like the right fit. USAID has just been a great partner for us, and it really complements our corporate vision of enhancing people's lives around the planet. And I think from a business perspective, again, I'm not on the foundation side, I'm not on the corporate affairs side, I'm on the sales and marketing side. And I think there's a good business strategy that says, if we can help influence the adoption of ICT, that's good for the governments, it's good for the healthcare systems, and it's good for technology companies such as Intel. So we're excited about the opportunity. At the same time, we're looking at there's a lot of work ahead of us, but we think we have a chance to make an opportunity and really enhance those lives. So we're very eager to get started. Thank you.
Okay, thanks very much. So I'm Erica Kochi with UNICEF, and for UNICEF, commitment to this partnership just seemed very natural. We're in 160 countries, and sort of our core bread and butter really is working to save lives, especially in maternal and child health programs. We're also the largest trainer of community health workers in the world. So as we see the more and more of them start to have mobiles in their hands, we realize that this is a tool that is really going to be transformational in the work that we do. We work in the hardest to reach areas, and partnership is definitely something that we've been doing with private sector and with other public sectors groups as well, and we've had a long-standing relationship with USAID. We also have some of the largest mHealth deployments in the world. We're scaling in 5 countries partnering with government to make this happen. For example, we registered 7 million births in Nigeria this past year. And in Uganda, we have over 180,000 citizen reporters reporting on sort of the healthcare delivery and other essential service deliveries in their community. So UNICEF's really seeing mobile and technology as one of the ways that we can really strengthen the delivery of our programs. And we realize we can't do this alone.
Hi, so my name is Robert Jaron. I'm Senior Director of Government Affairs for Qualcomm Incorporated. We viewed this as a wonderful opportunity to continue upon the work that we started back in 2006. We have a strategic program called Wireless Reach, the idea of which is to bring connectivity to underserved communities around the world. We have 73 projects in 31 countries, over 20 of which are in healthcare. And to give some context about the importance of connectivity, you've probably heard this over and over again at this conference, but we're closing in on 6.5 billion mobile subscribers around the world. And that includes not only cell phones, but smartphones, laptops, iPads, etc., which have wireless, wide area network connectivity. That's an important figure because as time goes on, that's only going to increase. There are statistics that Ericsson, for example, claims that there will be at least 50 billion connected devices by 2020, which gives you again some context. Having said that, Qualcomm is the world's largest producer, fabless producer of microprocessors that go in cell phones, wireless microprocessors, and we're very happy with that. And what we tried to do with Wireless Reach was focus on very specific segments, be it entrepreneurship, public safety, environmental sustainability, and obviously healthcare and education. So when we had the opportunity to partner with USAID, which we've partnered before with USAID, we thought this would fit in beautifully with our portfolio. As with the other partners here, we're very much invested in maternal and infant issues.
Hello, I'm Lee Wells from the Vodafone Foundation. Interestingly, perhaps, both the foundation and the business have committed to joining this particular PPP, and I think there's good reasons for both. They're overlapping, they're not exactly the same. For the foundation, we have the luxury in the work that we do of starting with public good and then working back perhaps towards commercial sustainability. It would be inappropriate for us to be sort of garnering business, but very clearly the business has a number of useful tools that it can bring. I often think of it as a little bit like building a wall. The businesses often have the bricks. It's the mortar that's often very difficult to find to stick these things together, and that's where the foundation can take a step back and not just provide a given technology. I think that's also important in weak healthcare systems, where you find that there are a number of different weaknesses. If you go in there as one partner with one particular solution, you're going to have real difficulty because it gives light to a whole load of other problems the moment you sort of lift the stone and you find all of these additional things. So having such great partners to work with is a real attraction. I think for the business, risk sharing is part of it. I think reputation is also part of it. I think when many businesses find that when they get involved, roll up their sleeves, and with a genuine commitment that often starts at the board level and comes down through the organisation to really make a difference. Yes, bringing the business know-how and the commercial expertise, and obviously an understanding of how you make things sustainably commercial. There's also the risk there that there will be naysayers. Oh, you've picked the wrong target, or you've picked the wrong area. So working in a PPP like this, I think, is very, very helpful. and I'm going to give a sort of an example of a PPP that I was involved with before with USAID in a previous life. And it was very interesting that on the board of the organisation that I was working, there were very, what I would call traditional Wall Street type people on the board, very hard-nosed business guys, not always welcoming of government intervention, if I can put it mildly. The moment for them where they saw that we had reached success was having a PPP with USAID, because they said, you're doing the right thing. So it's interesting, even in the quarters where you wouldn't necessarily expect it, how that carries a great deal of credibility, and I think that's important for the business. For both the foundation and the business, obviously maternal health is critical for us. We've made a commitment, which I've sort of detailed in another panel, about what we're doing in terms of eradicating fistula and preventing fistula, and using the technology that we have to reach people in remote rural areas in Tanzania. And obviously we're working on the ground in Tanzania with both the Tanzanian government, with the support of President Kikwete, and with USAID, and a number of other partners. So this is a very natural fit. Thank you.
Sorry, I have to keep coming up to the mic here. I was wondering if you could all tell us a little bit about what your organization has committed to the partnership in terms of resources and expertise, in-kind contributions. And I think Lee talked about this a little bit before in his remarks, but we made a strategic decision to engage with the business units within our corporate partners. So really, getting beyond corporate philanthropy, but knowing that there is a place for corporate philanthropy. So Lee touched on it a little bit, but I'd love to hear from Mike and Robert as well. Why do you think this is important, to partner with the business side? And what role does corporate philanthropy play in catalyzing new opportunities in emerging markets, particularly for healthcare-related products? So maybe a little bit around, the strategic decision about engaging with business versus philanthropy, as well as what your organization is committed to the partnership in terms of resources. And that second question is a question for everybody.
So from the Intel side, I kind of talked a little bit about the thought process of going through to, one, that make this type of commitment and what we bring to the table. And, just going back to public-private partnerships, it can be difficult. I remember being on the phone with Sandia and talking, and I could tell we were just talking right past each other. And so there was probably, 6, 8 people on the phone, and I said, I hung up, and then I said, I'm going to go call her. And so I said, can you and I just talk? And so we kind of I go, I'm still not going to get there even with this conversation. So it's difficult. Just even the nomenclature, the discussion, just the approach and the lens you look through is completely different from the public versus the private. So it took a couple of passes, and I think I even told you, I said, be patient. You'll get to understand, what Intel's about, the private sector, and we finally got there. And I'm glad I'm up here today to kind of, talk about that. So just a little bit of insight, and it takes a while to get on the same page and to be speaking the same language. But in terms of Intel's contribution, we're obviously a technology company. We're a microprocessor company. But we do have a lot of experience in the healthcare space. I talked a little bit about the ethnographers and social scientists going back to 1999. So we can bring a lot of that know-how and research into some of the use cases and user design. We've got a lot of experience in that space. But really where we're, I think, excel at is we're very good at going in and talking to governments about how to promote the adoption of ICT, information and communication technology. So how do we sit down with the Minister of Health, Minister of Education, Minister of ICT, and talk about how we put together a plan and share what other countries have done. So bringing that experience in to say, here's where you're at and here's where you want to get to. I can tell you 5 countries that have done that and are already there, and let's give you the roadmap so you don't have to start from scratch. And so they find that valuable. So one of the things that we bring to the table is the best known methods, the best practices of doing that. We have a very talented team of solution architects. That's the guys that I manage that are located throughout the world that can go into a room and whiteboard a solution to kind of show you how the pieces work together. And that technical support and know-how is very good. Matthew Taylor in the audience here is one of those architects that crafted a solution around e-learning called the School Healthcare Education Platform. That's a platform we've designed and built specifically for healthcare workers. And we're offering that available at no charge. And that's something that Matthew's done a nice job putting together. And then PC literacy. So a lot of people, you know, again, we think of there's a continuum of mobile devices from a phone all the way up to a PC, and we think, you know, choose the right form factor for the right job. Many people don't know how to use a PC when you put them in front of it for the first time. So providing software tutorials of how to do that, we have those kind of, we've come across those barriers before. So that's things that we bring, no charge, bring it into a government and allow them to do that. And I think from a policy perspective, you know, Robert, I know our companies have worked really well on a number of fronts in the policy space, but I think that's an area where we can come in and talk about, you know, what is your continuing medical education policy, e-learning, distant learning, and those types of things. And those conversations we've had before, and we can come in, and we can come in even jointly to do that. So from a perspective, you know, as I told Sandy, we're not coming in with a big check because we think there's other things that are in kind that are very valuable, and that's the initial things that we're bringing to the table, and we think it's going to complement a lot of what's the other partners are bringing as well. Thank you.
I'll just say a couple words on what UNICEF brings to the table, and also sort of our feeling about partnering with instead of just the philanthropic arm of private sector companies, but also the core business arm. We've found that, or I found that, I can't speak for the rest of my 10,000 plus organization, but I found that partnering with the core business units and having our partnership align with core business priorities of a private sector company is much more effective than partnering with them in an area or something that they do on the side, but it's not part of their core business strategy. An example I can give is our partnership with Frog Design. And Robert Fabricant at Frog and I spent a long time, probably 2 or 3 years, actually figuring out what we wanted to partner on and what made sense. And I'm glad we spent that time figuring that out. And it basically came down to empowering community health workers, actually very similar to this partnership, in the last mile, and bringing design and some sort of design resources and some of their processes to this effort. And it aligned with their core business in 2 ways that I think continue to be very meaningful for them. One, their fastest growing client base was mobile, whether that's mobile network operators or handset manufacturers, and their largest client base was healthcare providers or people working in sort of the healthcare space. And because, being able to work with UNICEF in this, showed that they were on, sort of looking at the next set of people that would be using their devices or, experiencing healthcare. And so because of this alignment, we continue to have a very, very strong partnership today. And so I definitely agree with Sandhya that, looking at trying to align with the core business practices is important. In terms of what UNICEF is bringing to the table, as I mentioned before, we're in basically almost every country in the world, save about 2 or 3. And we've been there for many, many years, and we will continue to be there for many, many years. And we work directly hand in hand with government. We don't have our own programs. All of our programs are to support the government and government programs. And I think because of this, when you look at country scale-up, it will be essential to partner with UNICEF and others like us who continue to be on the ground and have those strong relationships with government. So we bring our technical expertise, I think, in that area, and also in the sort of child and maternal health area to the table.
So Qualcomm brings to the table really just a technical expertise for the wireless setting, whether it be a wide area network itself, network planning or solutions, or even just the evolution of the technologies themselves. I think it's really important for other partners to understand what the capabilities are for the folks that we're actually targeting. That said, we're also very key on things like evaluation and monitoring and marketing. Marketing is an important aspect of any partnership and of this program specifically. And to go back to one of the questions from the moderator, which is, how exactly does this fall in line, or does it fall in line with our business practices? And that's actually a very important part of what wireless reach is for Qualcomm. We actually don't like to use words like philanthropy because this isn't a philanthropic project. The idea behind wireless reach is how best can we proliferate and continue to be socially responsible. And when I say proliferate, I'm talking about 3G technologies and 4G technologies and wide area network technologies at that. So for us, this actually falls in very nicely with what our core business is, and to expand that global footprint of wireless access.
So as the head of our foundation is apt to say, we are currently in the process at the foundation of trying to do less things better. As he always points out, there's always the danger that you do less things worse. And the guiding mantra for us is mobile for good. So there are a number of different things, of which our maternal health work in Tanzania is one, and that's one of the things that we're bringing to the table. The value of that with working with the USAID mission in Tanzania, but we also have something we're exploring also in Kenya, is probably $15 million for the former, and somewhere around $4.5 million for the latter, and that's both sort of cash and in kind and also management. So we will manage those programs and those that are actually implementing and ensure that it's across the health systems or the ecosystems where we're actually working. I suppose leveraging then is therefore something that we're bringing to the table as well, being able to go out. Part of the monies that we've raised have come from partners like Samsung, who have wanted to contribute. The employees at Vodafone have got particularly behind our Find Your Moyo campaign, Moyo being Swahili for heart, behind the obstetric fistula, and they've done lots of fundraising internally, and I think that's been very good to energise both the sort of business and the foundation behind this particular maternal health piece and bring awareness both of the technology and otherwise. But then I suppose as a business we've got a few things in the arsenal that are hopefully are helpful for the partnership. The first is the network itself. And in terms of its reach, thinking in particular of some of the countries where we operate that are most relevant, Kenya, Tanzania, DRC, Mozambique and India, by example. In those markets, they also M-Pesa, which I think people now recognise can be used in a number of different ways very effectively, and that's obviously one of the things that we think will be a significant advantage. And then specifically in sort of the health area, we have a platform called Mezzanine, which folks at Vodacom have developed. It enables legacy mobile technology platforms to communicate with each other. It allows for data collection and a number of different other elements in terms of training beyond sort of just the data collection, connecting healthcare workers at the front line, which I think is useful. So I think that's probably covers it. Thanks.
Great, thank you very much. Now I have a couple of questions that are specific to people on the panel. The first is for Intel and Qualcomm. I think in the marketplace you often compete in terms of your product lines, and under this partnership you've chosen to collaborate, and I'd be curious to know how you see that collaboration positively impacting on your bottom line. And maybe we can start from the other side. Start with Robert and Mike.
So I think Mike started on this in his last response, and I really do want to follow up. You have to look at a business from an overall approach, whether it be the bottom line or other peripheral things that you're working on that impact the bottom line, which have consequences that ripple over time. And in Washington, D.C., I have no closer ally than my counterparts at Intel. Specifically, a woman by the name of Alice Borelli, who I had the absolute pleasure and honor to serve on the U.S. Policy Working Group for 3 years for the Continuum Health Alliance. We worked together as co-chairs, and in that time we were involved in rulemaking for aspects of the American Recovery and Reinvestment Act. We were involved in the furtherance of new proposed rules and regulations from agencies such as CMS all the way to FDA, FCC, etc. We were involved in legislative affairs together, and it was not just her and I, but it was an army of other members, but it was really our direction, getting everybody to work together. And again, I think the key word of the day is partnership. And I think that really showed how two possibly competing companies can really work together towards impacting both bottom lines by achieving regulatory, policy, and legislative goals. And it goes on beyond then, because Alice and I actually both stepped down earlier this year because we had been doing this for about 3 years. At this conference alone, we've been at, I believe, 3 meetings together. I've attended sessions with her, and it just continues. And it goes beyond Alice. I mean, I have a great relationship with people like Eric Dishman, who is an authority in the area of healthcare in the world. You know, we've shared the presidency of Continua and other alliances together. So, yeah, I have no more important ally than, you know, a lot of people call us Bonnie and Clyde. So there you go. She's my right-hand man. So, you know, I'll defer to Mike for anything else.
Robert, I couldn't agree more. You know, just based on you know, the experience that I've had between the two companies, that, you know, around the policy and cooperating. Continua is another good example. You know, where Continua, and for those in the audience that don't know, that's an alliance that's been put together to help put together standards for medical devices like blood pressure cuffs, glucose meters, having a standard interoperable devices, plug and play, much like you would see with a USB. So that's an organization that Intel started and founded. It's a third-party organization, and Qualcomm is, you know, very much in the leadership of that. And when we launched that in China and India, and I think soon Brazil, you know, Qualcomm is right there with Intel. So I think the important thing when you look at you know, this particular space is you find the strengths of the companies, you find areas where you can work together, and you focus on those. And then the areas where there's you know, the competition, or if we've got competing products, I actually think that's a good thing. I think that's a good thing, that it pushes Intel to have better products, it pushes Qualcomm to put the best products out there. At the end of the day, the customer has to decide, and they have great choices, and so we let them decide. So from my standpoint, I'm all about, you know, providing the best product out there, and I think having us, you know, have those out there is a great way to do that. In terms of this partnerships, again, I think the policy piece is one where we can really bring those strengths, where we have a history and a track record of working well together, and help to put those policies in place around telehealth, e-learning, continuing medical education. We know how to do that and engage in the U.S. and other governments around the world, and I think that's, you know, one strength that we can bring to this partnership, where we've worked well and you know, kind of have an accelerated effect.
And actually, I just follow up. Mike said something else in his last comment, which was, you know, the relationships and the existing relationships with either ministries or regulators or other forms of officials, country by country. You know, that's something that we can leverage off each other, and that's something that we leverage off each other even in this country, you know, quite effectively. And it's really about exploiting and executing in those areas where we can complement each other, because, you know, we totally agree. The marketplace is vast. There are interests on every level for every product, and, you know, that's just the beauty of business. And it's great to be able to work together and actually, you know, impact each other's bottom lines.
So my next question is for Erica. I was wondering if you could tell us a little bit more about the UNICEF innovation team that you co-founded, and the work you're doing to accelerate the use of mobile technology for frontline health workers in particular. And also you co-chair the Country Scale-Up Task Force under this partnership, and I know we're in the very early stages of what we can be doing in this space, but if you can share maybe a little bit about what your vision might be for what we can achieve under this partnership at the country level.
Sure. So the integration group in UNICEF is probably not the most traditional group in UNICEF. We, my colleague Christopher Fabian and myself, saw an opportunity about 4 or 5 years ago where we started seeing mobiles in even the most rural, remote locations. There would be a mobile phone. And so we were given the protection and the space and a very small amount of funding to figure out what that would mean, or what that could mean for UNICEF. So for the first couple of years, we operated very much in a startup approach, trying something new, failing very quickly, getting feedback directly from either users or our management at UNICEF about, was this the right approach? And I really think it was sort of that combination of starting things and trying things and failing at them and learning from them that sort of really led to our more longer-term successes now. I think our first breakthrough was we, in about 2 weeks, quickly in Ethiopia built a system which is now become Rapid SMS to monitor the distribution of ready-to-use therapeutic food, because Ethiopia was going through, had just gone through 2 droughts, and was really trying to prevent famine in 2008. So that was the first interaction that we, or first deployment that we had, which we actually showed some real success in. And sort of from there, we started to realize that having a very simple mobile phone and doing very simple text messages could provide a tremendous amount of information that would really help us manage our programs in real time. So we started down that route. I guess now we're probably much less in startup mode. We're still a small team, but we're growing much more in the field. So country offices are hiring technology for development or mobile for development people to help start and run mobile projects that support UNICEF and government programs. So we expand, but we're not, we don't have the same structure that UNICEF does. There's not a health officer, at headquarters at regional level, and the country office. We're a very different sort of amorphous group. And I think that, probably, or my hope is that there will not need to be someone who's working in mobile health, forever and ever and building up a large team at headquarters, but that this would become part of health programs themselves. So it's second nature to think about using technology and mobiles in healthcare programs. Does that answer your question?
Sorry. One last question to Lee. I know you've talked a little bit already about the fact that both the Vodafone Foundation at its highest levels as well as Vodafone, the core business, are part of this partnership. I was wondering if you can say a few more words about particularly, oh wait.
Hang up, that's the person telling me what I'm supposed to be saying.
I was wondering if you could expand a little bit on the business side. Particularly, I know that Vodafone has a whole group looking at mHealth solutions and mHealth services, and how that might actually be able to contribute to the goals of this partnership.
So the mHealth Group at the mHealth Group at Vodafone. One of the I got a bit of a pep talk from them just before heading out to come here, just to ask them what some of the challenges are, and maybe that's sort of reflective of why they're involved actually, because I think they often have found, in terms of getting to scale, getting people, whether it's at the ministry or whether it's with NGO partners or others, to be very clear about the actual program, and whether it's a contract or a negotiation is very difficult. Often the question is, well, what can you donate or whatever, and inevitably then it's going to be small scale. It's not going to move to scale. So looking for opportunities, I think, to operate at scale, and having within this sort of hothouse sort of environment of a PPP, areas where you can thrash out many of those negotiation sort of questions and be very clear about what you're putting in, what you're getting out, is actually really very useful, because automatically you are then talking about something at a much larger scale, and then you can start to bring in some of the commercial products, as well as obviously the area that we're working in at the foundation.
So we have a few minutes left for questions, actually quite a few minutes left for questions. So I would love to hear from all of you. I'm sure you have some questions.
Hi, my question's actually for you. I don't know if you have any voice left to answer it, but my name is Maria Freitas, and I work with a mHealth Alliance-funded project called Maternal Concept Lab. I'm a midwife, and I have a background in midwifery training, and I've been really excited about the potential of empowering frontline health workers, and I think the partnerships are amazing. The one thing I see missing is, how do you plan to address the needs of midwives and nurses who are working on the community level? This question was asked in a previous session, and the answer was, well, the needs are the same, but actually I think the needs are somewhat different. And tell me more about how you see the differences, because we've actually
haven't yet put a ring fence around the definition for frontline health workers. And we see that there are a lot of opportunities with different cadres of health workers, so we haven't excluded anybody yet. But I'd be curious to hear your thoughts on what are the major differences.
Sure. So in talking about maternal mortality specifically, you know, midwives and nurses and others with midwifery skills are the people that can really impact maternal mortality, and that's been recognized by the global community, and there's efforts to build up the midwifery workforce, and I think it's a sort of a parallel effort to this one. And those people do really clinical kind of work, and they do it in the home. You know, they do it at the community level. So there's a world of things that can be done with mobile to help them, and I think that some important partners would be the American College of Nurse Midwives, the International Confederation of Midwives, and those people are informing your implementers, but I think that they would be really important to engage on the partnership level.
Yeah, that's great. Thank you so much for that question. We actually, at the same time that we launched Empowering Frontline Health Workers, we launched another partnership called Survive and Thrive. And that partnership is actually with a number of the professional associations you just named to build the expertise and sort of create the twinning partnerships that are needed between the international associations and local associations in these countries. But I was wondering if actually, Mike, you might want to talk a little bit about school and the school platform and how you've been committed to using that platform to really encourage distance learning of nurses and midwives.
So I briefly mentioned the school healthcare education platform. This is essentially a software platform that we're making available at no charge with an open access license. The architect, Matthew. Raise your hand, Matthew. Come on, take a little. He's the brains behind this thing. And we've actually had it at the booth for the last few days. I guess the booth is now closed. But this is something that, to the point about midwives and community health workers, you know, what kind of tools can you provide them? And really, it's how do you, from the way I understand it, again, I don't have a medical background, but people get trained, they get deployed to a remote location, and then they're kind of cut off, right? So they don't have the supervisory skills. It's very difficult to keep their skills current, keep them trained, continue medical education. So the approach that we're taking with several governments is to provide this framework or tool that sits on top of a computer, and there's after this thing or a tablet that you can have access to, and you don't need a phone connection. You don't need to have connectivity to the network. So if you're in a remote location where there's maybe no power, no water, no connectivity, you still can have access to this information, take the classes, and it provides feedback on how you've done that. So we think that the link to capacity building is one. How do you get more people trained in terms of the schools, and then you can bring that tool into the schools in terms of e-learning. And then once you've been trained, how do you stay trained? And I think this type of a tool with the technology is a way to give people that access, assign people training on certain interventions that are most prevalent for infant mortality and maternal health, so that you can reach them, even though they may not see their supervisor every 6 months. So that's just one example where I think technology can play a key role of kind of addressing those gaps that you've talked about.
Thank you very much. My name is Peter Benjamin from CellLife in South Africa. And first, thank you for the session, and kudos, congratulations to Sandia and USA for putting this together, and to all the other partners. My question is, this is all very impressive. How can it be of direct use to people in different countries? The example is this. Yesterday I actually received an email from the Department of Health in South Africa. There's a meeting happening next week, Wednesday, to plan how to get mobile tools for the planned army of about 50,000 community health workers over the next few years. There have been a few small pilots in the country, including the mezzanine platform that Lee mentions, something CellLife is doing, something that Mobenzi and a few others. We know of other tools, there's Damagi, D-Tree, Motec, and others. How can a national government that is trying to put together a coherent platform harness the experience and resources and things that you've put together? Are there, when that library of content, that would be very useful, I'll definitely be telling them about this partnership, but how, are there resources, are there guides, are there suggestions of way forwards, because there's a great example. Next Wednesday, the Director General is going to be asking this question. What do you tell them? Thank you.
Wow. No pressure, right? Yeah. So, so I think, we are just getting started. So I don't think we have a good answer for you yet. I do think that, and I think that there are, a lot of, technology choice is just one very small part of, I guess a government's decision about what they want to do. I think sort of at a country level, our role, I don't think we're going to be advising or helping every single country in the world with their mHealth strategy. I think sort of in the country scale-up group, we've agreed that we need to figure out how to prioritize just on a couple of countries, and otherwise we'll be spreading ourselves too thin. And I really like what the motto at Vodafone of doing less things well. I think, and that's the approach that we're going to be taking. I think one of our roles will be to be able to, with the mHealth Alliance and all the partners, bring together some of the best practices that have come out of, pilots in the field, and whether that's, scale-up strategies, budgeting, technology choice, etc., and bring together those resources and perhaps even with our colleagues at WHO, put a rubber stamp on, this is a best practice. So I think that's one area that will be sort of most useful for. And then I think in a couple key countries is really help see where the gap, do an analysis of where the gaps are and what further resources that we would need to bring to bear to ensure that there's like a strong mHealth strategy and plan, and then that's followed through. So I don't think we're not coming in and saying this is the only way or this is the way and these are all the details, but I think we need to be strategic about choosing what we want to emphasize. So I don't have really an answer for you about your meeting next week. I'm sorry. Basically, and that's a preliminary way, our preliminary way forward. But not everyone in the group has agreed on that. So.
And I appreciate it.
It's a
I
caveat,
have
basically.
a feeling I'm going to get a punch in the arm after the panel for tossing that one over to you. But maybe just to add, the USAID, mHealth Alliance, WHO, UNICEF, and others have been working, because we've been asked this question a lot by ministries of health and governments around the world. Sort of, there's so much out there, so much has been successful. What should we choose? How should we choose? What are the tools or the guidance that you can give us to really think through what we should be putting in our mHealth strategy, which technology we should be scaling up, et cetera. So we are actively talking about that, and not only under this partnership, but generally about how we can actually serve, how we're able to provide better technical assistance to country governments so that they can really make an informed decision around technology and mHealth. But the only caveat I would say is, technology is not going to solve all the health system problems. So we have to just be very careful when we talk about technology as an enabler for health systems improvements. But, as in that equation that I showed, health worker performance is one piece of an equation that includes many other elements. So it is important to make sure we put it in the context of the overall health system, demand generation, supply chain, all these other pieces. Yeah.
Yeah, that's a great question, by the way, because it's always, where do you start? And I don't know how many days you've been thinking about that question, but it's a good one. One of the things that I've noticed is it's not one size fits all. So when I go into, like I said, I've been to many countries and I've sat in front of many ministers of health, and I always kind of, rather than me do the talking, I kind of sit back and find out what the pain points are. So whether it's infant mortality, maternal health, if it's attrition of workers, capacity building in the schools. So based on what he or she says to me in terms of where they're having trouble, that's kind of where I decide where to start. So is it low connectivity? Do all the clinics have broadband, and do they have phone connections? So guidance to you is find out what those pain points are and direct it. And maybe the first step is a national broadband plan to get broadband in the country. Maybe it's there, maybe it's not. I haven't been to South Africa for a few years, so I don't know where it's at. But I think you're going to find that there isn't a one size fits all, or here's a starter guide to do it. You're really going to have to kind of see where the biggest gaps are and start there first. And then I think you put together a plan, and then folks here at the table can share those practices about if it's broadband, if it's continuing medical education, if it's telemedicine, whatever the case may be. That's when you start to work on what's most urgent.
I would only add that one place for you to look immediately would be the GSMA organization, gsma.org, I believe. They have an mHealth program. Within that program, there are several white papers and other case studies that they've written over the last couple of years to talk about issues like the one that you just brought up. I'm not sure that you're going to find a one-stop shop anywhere, but that's going to be as close as possible. The other is just contacts, and think in the way of, these people are approachable. I know that there's a GSMA representative here. They were downstairs in a booth. I would approach them. They can put you in contact with other colleagues. One woman by the name of Janine Voss is somebody that you may want to reach out to. If you need her contact information, I can give it to you. Because of the timing that you have here, only 1 week left, I'd start off at GSMA, maybe look at other countries and see how they've dealt with mHealth. For example, mHIMSS put out a roadmap just yesterday. It's made available online. It's very U.S.-centric. They're going to expand that globally soon, but at least that'll give you ideas, because no matter how many things change, it all really stays the same. Country by country, we're very similar. So you may want to look at how other countries have dealt with this. And I thought that the idea of the broadband plan is a very good one. We actually delivered, meaning the FCC delivered a broadband plan to Congress a couple of years ago here in the U.S. There's an entire chapter on healthcare. Chapter 10, so you may want to look at that chapter as well to, really just form your ideas and inform your decision making.
So I'd like to congratulate everybody on a great presentation, great partnerships, and I'm saying this because I'm about to ask a completely unreasonable question. So I'm buying a little political capital in advance of the completely unreasonable question. You guys have thought a lot about all of the issues around getting technology into the hands of health workers that can help them be more successful. There's some kind of critical things that will get in the way of that. And I'm really wondering whether it makes any sense to think about these or not. So here's a couple of examples. When you reach the point of adding improved technology to a health worker who isn't being paid, how do you make the trade-off between that issue, for example? And does it make sense for you to be engaging other partners? And I would suggest social enterprises as an example, or organizations who want to scale, social enterprises who can provide the economic development so that there's actual income generation to pay the health workers. I mean, I know that's unreasonable. You've got a big task in front of you, but there's opportunities for you to kind of have some APIs, to use the technical term, to other organizations or other partnerships or other ecosystems who could bring stuff in that would lessen the pain of that issue. Another example would be, you're sitting in a health system in many cases which is 80% private pay. And so there's a whole set of issues around what could you do to interface with people who are trying to figure out how to provide insurance into that city, into that country or that organization, and where are the interfaces, and should you be pulling them into this effort, and should you be advocating for ways in which that particular issue should be dealt with in conjunction with what you're doing, again, so that everybody gets treated fairly and you end up with a professional community health worker organization, which will never exist if the people aren't being paid. You can give them as great a technology as you want. You will never have a professional community health worker organization if they're volunteers. So those are just a couple of entry points where you have a lot of throw weight given the companies involved here, but that throw weight may not have the impact it could have if it just stays with the partners that are there and it doesn't interface with some of these other potential trends and changes that you can help make.
Thank you so much. Totally relevant points. Just wanted to say that it is important to note that, we have, although it seems like a big partnership, it's a relatively small partnership of 10 partners, but we know that there's all these other efforts, particularly, for example, the most recent 1 Million Community Health Worker Initiative that was launched by Jeffrey Sachs and the Earth Institute. Their main goal is to really encourage country governments to professionalize the health worker cadre, to pay health workers, to have, actual assignment of responsibilities that are standard and have the supervision and monitoring systems in place. Now, that's a much bigger effort than what we're trying to do under this partnership with mobile, but I think what we're doing under this partnership can enable that larger cause, and we're very happy to know that Jeff Sachs and others are actually working at that level to work directly with country governments, the Global Fund, PEPFAR and other large players in the space on the broader issue around addressing the global shortage of a skilled cadre of professional health workers. So we're plugged into those. We actually just met with Jeff Sachs about this partnership. We're plugged into those larger efforts, but I would love for Lee to talk a little bit about what Vodafone is doing, particularly around mobile payments and health workers as well as insurance.
So in some of the work that I was doing previously at the Touch Foundation with McKinsey and Company, they did a large study called Catalyzing Change, looking at across the healthcare system, sort of from top to bottom in the lake zone. It's about 15 million people. It's a third of Tanzania, both geographically and in terms of population. Looking at retention as a major issue, because Touch Foundation were training healthcare workers, both midwives, nurses, doctors and others, and recognising if they were about to send them out to district hospitals and elsewhere, they needed to know a little bit about what was happening at that level. Often healthcare workers are not paid for the first 6 months when they arrive at a new post. They're probably, if they're a doctor, they're going to be the only doctor at a district hospital currently. So thinking of some strategies, some of which are making sure that they get paid in a timely fashion. So that's where I think the technology offers a really huge advantage. I'll give an example. I believe it was in Afghanistan where a payment system similar to M-Pesa was used, and all the police thought they'd got a pay rise. They hadn't. They just got the money that they were supposed to have got, and they'd taken out the various ways in between. So I think there are some creative things we can do. What we're looking at also, so part of what we're bringing to the table is also, I was mentioning leveraging, it's also some work that we're doing with Swiss Re, looking at what I'll call the maternal health continuum. So everywhere from the mother first presenting or actually receiving sort of education prior to falling pregnant, presenting with the community healthcare worker or the clinic, right the way through then to getting to the district hospital for complicated deliveries and all the points in between, seeing the nurses and midwives and finding out which, we don't know enough actually about the household economics to work out if there isn't some way of making it sustainable where you have the women saving perhaps, or the communities saving to pay for the transport or to pay for the community healthcare worker, or the saving which we know they already are paying traditional birth attendants. So trying to work out some way in which you can formalise that and maybe using the technology as a means of achieving that. As an overarching thing, I would say the important thing for me is that often we think about the hierarchy of the healthcare system. You think about facilities. I think the huge advantage that mobile brings, and this is why I was very keen to work with the foundation and to work on the PPP on a personal level, is to actually be thinking about clinical networks, about connecting people both horizontally and vertically. That's something where people are currently it's like parachutists. They're dropped behind enemy lines. They're completely cut off. They can operate for a time, but if you don't actually come in and relieve them in some way or another, they're going to be in real trouble. So that's what I see as the huge advantage we have here. But it needs to be well managed, and I think that's the thing that for each of the institutions here, that's one of the strengths that we'll bring to the table, is that management. And that's when you've got a weak healthcare system, it's often weak management as well, for lack of training and resource and capacity. And that's something that I'm very excited that, I think each of the groups here and those involved in the PPP can bring to the table, managing that ecosystem.
And maybe if there's time, probably not now since we're actually over time, but we'll take one last question if we can have a quick response. But, Vodafone is working with Switchboard to look at the possibilities for closed user groups of health workers so that they can communicate with each other so they aren't cut off from each other.
And just one other minor point. Even though a steering committee has been organized, they're still planning and organizing a technical advisory group, or advisory group rather, which will be composed of stakeholders, agencies, et cetera, which will hopefully, do exactly what you're mentioning, just really inform that and other issues that are important to this initiative. So just wanted to make that point.
Great, thank you. So just this question, as we're a little bit over time, and so maybe just one quick answer.
Very good. Thank you. So the name is Ben Nardone. I work for a company called Pathfinder International, and we do sexual and reproductive health work in Asia, Latin America, Africa, so all these sorts of places. The thing I'm really excited to hear about is the content sharing platform, and I wonder if I could hear a little more about it. I guess specifically I'm wondering if it will include things like content creation tools. So when you think about doing derivative works based on other people's, one of the first things you think about is, do we have the same tool set? And I guess the other component I'm really curious to hear about is if we can hope to start seeing RFAs coming out, sort of building into these programs the idea of sharing back the content that gets created as part of the program.
Wow, did somebody plant that question? That's pretty amazing. Your colleague Marion McNabb is on our technical advisory group, and yes, all of the above. We're looking at crowdsourcing content through platforms such as the one that Tom, raise your hand, is putting together to commission new content, particularly multimedia content. We're looking at landscaping the gaps around content, making sure that we have the content that we need. We're looking at a repository for content, and we're also looking at what does it take to actually share back content that's been adapted. And so I had said earlier that Brendan Smith and Brooke Partridge of Vital Wave are actually helping us put together this content strategy. And actually tomorrow we're having a meeting with the technical advisory group around what are the different options for what that strategy looks like, including all the elements that you mentioned. So please stay tuned, stay in touch. Thank you so much, everybody, for being here. Please join me in thanking our esteemed panelists.